My mother was Elizabeth Beebe, and she married my father, who was a school teacher here in Lewis, and subsequently he went to work for the DuPont company, and we moved to New Jersey and then back to Delaware. So that I actually graduated from high school in Newark. My grandfather, who we didn't call grandfather or grandpop because he thought he was too young, was Dr. James. So we all called him Dr. James. I was delivered. Dr. James had kept very strong association with the people at Jefferson, and he provided some of the newer surgeries and so forth in this area by bringing down the professors from Jefferson. And as a matter of fact, the professor of obstetrics and gynecology was a Dr. Thaddeus Montgomery at Jefferson. And he was a good friend of my grandfather's. And my mother had had some problems with a prior pregnancy. And he came down here and actually delivered me. And then later, he was my professor when I was in medical school. I started working at the hospital with my grandfather's permission when I was about 16 years old. I wanted to be a physician ever since I can remember. And he let me work in the hospital as an orderly. I emptied bedpans, did bed baths, and so forth. So I've worked from the ground up. And subsequently, then I went to the University of Delaware, graduated from there in 1958, and then I went to Jefferson and graduated in 1962. It was my father's decision, really, because we lived in Newark, and the tuition at that time at the University of Delaware was, believe it or not, $75 a semester, plus your books and so forth. And my father was a rather frugal man who thought that that was a reasonable thing, and the University of Delaware had a good reputation and a lot of, at that time, the majority of the physicians in Delaware, at least in lower Delaware, had graduated from Jefferson. So that it was sort of a tradition that you go to Jefferson. Well, I liked surgery to begin with, and the professor at Jefferson was very dynamic and outgoing, Dr. Anthony F. DePalma. And in my classes, I just became enamored with orthopedic surgery. And I took my residency with him. Now, at the time, he was not accepting anybody in the residency unless they interned at Jefferson. I really didn't want to intern at Jefferson because I thought, you know, I'd spent 4 years there. I just didn't want to spend another year as a medical student, so to speak. And I became associated and knew Dr. Leonard Lang at Memorial. And I was very impressed with him and as a teacher and so forth. And he encouraged me to come down to intern at Memorial. I did, and I went and told Dr. DePalma, I said, you know, the reason I want to get out is I don't want to be a fifth-year medical student. I want to get out and see what I can do on my own. And he said, fine, you're in the residency. That was my interview. So now they go through all sorts of interviews and so forth, but I talked to him in the locker room at the hospital at Jefferson. It used to be when we did hip fractures, we opened them up and nailed them under direct vision. Now we use an image intensifier. We do it through small incisions and so forth, and we're doing joint replacements, which we weren't doing when I first came here. I did the first joint replacement here at Beebe. It was a hip replacement, and I was looking for an ideal candidate because, you know, if you're going to start a program, it's always good to have a good result with your first. And I had this retired banker from Dover who was an excellent candidate, really well known, very vigorous and outgoing. And at that time, rather than what we do now, we would bring them into the hospital and then do their workup, you know, medically. Now we do it before you come into the hospital. And so we get him in the hospital, and doggone if he didn't have an abnormality on his electrocardiogram that they couldn't clear him. So he ultimately got that worked up, and I ultimately did him, and he did very well. But well, I think a lot of the medical societies function are administrative and so forth, whereas the academy is more engaged to education, and the library at the Academy. And we commonly, our librarian here at the hospital commonly contacts the Academy for reprints of articles that we need and so forth. And it's a cooperative venture as well, as you know. The libraries at each of the hospitals have a direct link to the library at the Academy of Medicine. And now the library at the Academy of Medicine is even better since it's been combined not just with the library from Lovering Avenue, but also with Christiana's library. Well, I think it's seeing patients get better and, seeing them improve their situation in life. And that's what, with joint replacements and so forth, that's what we do. We don't save lives, we improve the quality of life. And if we can improve the quality of life for the patients, then I think that's a big satisfaction. Seeing patients get better after significant injury is also, I think, a big plus. And advising patients, I think, is important. And, after you've, in my case, even though I'm an orthopedic surgeon, I've been here a while, and Dr. Beebe can tell you the same thing. People still call us older guys asking, what should we do about such and such? Not necessarily having to do with orthopedics, but who should I see about such and such? And, I think that's important. And, when I first came back to Beebe Hospital, it was Beebe Hospital then before it became Beebe Medical Center, I think we had something like 35 physicians on the staff. We now have close to 200 physicians, and almost all specialties are represented. So there's been a big change since 1980. And I think there's going to be even bigger change because, as you may or may not be aware, we started doing open heart surgery here at Beebe Medical Center in February of this year. And it's a combined program with Christiana Care, so that the cardiac physician here is a member of the Christiana Care team. And I think it's an excellent association because those that may not be amenable for treatment here, they're going to be kept in the same system and sent up to Christiana. And it's working out very well. But if you'd have told me 20 years ago that we'd be doing open heart surgery at Beebe Medical Center, I would say I think you'd head examined. But it's working out very well, very well.